because it looks like, just probably get it to the table a little bit, not quite to the table, but so it doesn't look like I'm just, that's what I wanted to do here, so there's just more than just my face.
Yeah, that's fair. Okay, you're all good. Okay, so you're going to cue me. I'm just going to talk about the, I guess I'll just let this all get running.
All right, so we are live. I am just allowing some time for everybody to come in here. Looks like we're slowly rolling in. Awesome. Okay, great. Well, good afternoon, everyone, and thank you for joining us for another one of our WESC webinars. My name is Josie, and I am WESC's marketing advisor. WESC right now is currently offering free webinars every Wednesday, and you can take a look at these on our website at wesc.ca/events. As we're all joining here, if you could go ahead and write in that chat box at the bottom of the screen, if you can hear me okay, that would be great. And I will just point out too that there is a chat box and then there is a Q&A box as well. So as we're going through the presentation and as you have questions for Deb, you can put those in the Q&A chat. But for stuff like this, you can go ahead and use that chat box at the corner of the screen. Okay, it looks like people can hear me okay, perfect. So just a reminder, this webinar will be recorded and will be available for on-demand viewing on our small business resources page by the end of the day today. And you'll also be receiving an email from me tomorrow at this time with a link to the recording as well. So keep an eye out for that email from me tomorrow. So today our topic is riding the benefit waves of COVID-19, and this is presented by Deb Wiegers from Wiegers Financial and Benefits. Deb, thanks so much for joining us today. I will hand it over to you now, and please feel free to start whenever you're ready.
All right. Hello, everyone. How are y'all doing? Look at this. It was a beautiful day. I ended on a beautiful day when we were doing our live sessions at the end of June, and I came back to a wonderful day. So the only part is I got to be out there walking on the riverbank to really, truly enjoy it. But thank you for joining in, and thank you for taking the time to really want to get to know a little bit more about what's been going on in my world, but in a lot of ways it's impacting what's going on in your world. So we want to make this a little bit more interactive. I know that there's some shy ones out there, but I know there's some gals out there that love to ask lots of questions. I'm thinking maybe Sean is in the audience. Maybe Mike's in the audience, but there's always a question or two coming from those folks. So we do want to spend some time talking about what's happening. And I'm going to give you an overview of just of the agenda, because I want you to know kind of how the sequence is going to work. So if you know, and for those who had an opportunity, I am Deb Wiegers, and I am the benefits consultant for Wiegers Financial. I always forget to introduce myself. You know what? I'm going to do this, and I'm going to introduce Colton right now too. So Colton Wiegers. And he's always so gracious to join me. He's my tech support, and he's the fellow that's going to be able to read the questions over there so that you're just not looking at my nose in the screen. So I've got two sets of glasses, as you can tell. So one for far, one for near. So I know it's a disability, but anyways, I wanted to just, go back to, some of the things that were happening when we first launched our Facebook Live. And a lot of it was based on the fact that we were just kind of riding this wave. And that's why we wanted to call it that, because we didn't understand where this all was going to go. Neither did any of you. In fact, I think a lot of us thought this was just going to blow over in a few weeks. But here we are. And it's the middle of September, and we're into maybe some of those predictions that were made from some of the speakers that I had back in May and June. So it was really just to say, what really happened. So I thought we should go back to 2019. And let's go back to 2019 and talk about, what were the trends that people were thinking about before any of this COVID stuff started. So that'd be number one. Number two comes COVID. Middle of March, fast and furious, bang, and we're out there and everybody's scrambling and things are changing all the time, and I'll address that, and that's all I want to do. There's not a lot of conversation. It's really just to address what happened in a very short time. Number three, predictions. So predictions came in April. Everybody's saying, all right, here's this COVID stuff. What do we think is going to happen once this is all done and gone? But what's going to be interesting is in June came another report called post-COVID. and it was focused on benefits and what predictions are really following through into what's going to be happening. And it's really actually still too early to tell. We're seeing some movement, but also 2021 is going to bring on a whole different twist. But there will be a lot of these waves that will continue, maybe rise up a little bit more and they might drop down. Maybe some of these things are going to go away. So as you go through these sections with me, you'll see where there's a lot of common links on that. I've got Colton, and I wanted to introduce Colton because I do want to say thank you to WESC, to all the team at WESC for allowing me the opportunity to take a few weeks off, and we'll talk about what happened in Debbie's world through the COVID period. But in the interim of that, graciously, the WESC team had allowed Colton Wiegers and my office manager, Pat Kyle, to speak to you in the middle of July. And they talked about what was happening from an employer's perspective. So a little more about the HR side of things and what they were seeing. So I do want to say thank you, Colton. I mean, you guys I saw the video. I thought it was awesome. And was there any takeaways that you can tell me that came back from the questions of the crew that listened in?
Absolutely, and I'll slide over a smidge so you can hear me, but we're trying to keep the distance in our office as best we can, and we've got masks going on now too in public spaces, so kind of trying to keep safe.
Yeah.
But like I mentioned, Pat and I did that first session. I feel, I'll even just get slightly over. Okay, so we feel it went pretty good. We had a lot of people asking a lot of questions, a lot of people curious, and one of our big takeaways was that, everyone always says the whole we're all in this together type thing, but this one was like that. This was the thing. We're all in this together. Like you mentioned, no one knew what was going on really. People had predictions all over the place and the dust started to settle. So what we found was pretty cool was that people were very eager and excited that we were happy to share. Pat put together a COVID playbook in a sense, like emergency response, manual for our office. And I don't know, like raise your hand if you had a pandemic response, in your employee guidelines book, and then put it down because you're lying. No one knew that was going to happen, right? Like that was just absolutely unexpected. So you have to develop all this from scratch, right? And there's not really a framework to do that. So Pat put together a ton of great things. We followed up and shared a lot of those with people after, and that was what we found was pretty unique, was that there was a lot of open discussion and people willing to say, hey, I could use that help. I could use that information. Everyone's, willing to help each other, but no one's too proud to say, I know exactly what's going on and I have it all under control. I think we're all willing to admit it got a little crazy at times. So that was pretty neat.
Thanks, Colton. And I know, and thanks again to Pat, because I think most of us that were putting in policies and procedures probably had some basics about what to be thinking about, but truly didn't address pandemic because we all thought that was just a storybook or a movie that we'd watch or listen, right? So who'd have known? So it's been quite useful, I think, to a lot of people that listened in. She's been sharing a lot of that information. And as she mentioned in her session, why make everybody recreate it when you can borrow and modify it, make it yours? And that's what we'd be willing to do. So please be thinking of us. So we're going to start with a poll because this is how we get y'all going. On a scale of 1 to 5, 1 being no concern, maybe very, very little concern, 5 being concerned. I want you to ask and answer back, just on a scale of 1 to 5, what do you believe COVID has done? Are you concerned about it? Do you think that the COVID has been a good thing? Do you think it's been not so good? Everybody's going to be in different positions in terms of whether you're an employer or employee, types of industries that you're in, but certainly want to hear on a scale of 1 to 5, like how do you feel COVID's going to move into your space in the next months and maybe a few years? So that would be it. If you would love to answer, if you are very concerned, what is that one thing that you're concerned about? Like what's making you nervous or what's making you not sleep well at night? If you're not concerned at all, then I think that's a great thing. I think that you've seen this as an opportunity, and some of the clients that we have had some really great success this summer because of the space that they're in, and COVID's actually worked in their favor. So it's just really nice to get a little bit of that feedback from both perspectives, and hopefully we can all learn and grow together as we start talking through some of these scenarios.
So we do have some information coming through. Apologies, we were thinking this when we set up the poll that it launched them both at the same time. So we are going to come back to question number 2 about mental well-being. We'll probably, if I can reopen it, I will. If not, I'm going to just write down the responses for that one. But we'll
now I'm going to get my distance glasses.
We'll revisit that one. The way it's set up, it made it seem like they were separate questions, but it turned out to be one thing. So apologies there. What we're getting for response, though, is kind of all over the place a little bit, but more, I guess if you count it up, over half, though, are either middle concerned or very concerned. So only 2 people have responded saying not very concerned or a little concerned only.
Would love to hear, I'm going to assume this has turned into an opportunity for you, but definitely it's like a 60-40 of mid to high concern. And then people on the other end of the pendulum saying, it's okay. So good to see. Keep them coming. So what I'm going to do, we're going to move, because I got to watch my clock, and Colton's going to help me do this too. I want to move.
Before we go into that, we want to make sure we're going to do this at the beginning, but it's a good kind of testament to, or good thing that Deb mentioned, is that if you have not used the chat option before or the Q&A portion, I know sometimes it gets a bit confusing in that regard. So I'm going to close this poll right now, and we're going to go back to, I'm going to open up the Q&A. So if anyone who hasn't used Q&A, can you click there and ask a quick question? You can ask Deb anything right now, whatever you want. What was your favorite thing that you did in the summer?
Did I drink my smoothie this morning?
Yeah, what's your favorite? I see the smoothie right there. So
half drink.
Yeah. What's your favorite, pet or animal, favorite food? Because this is where we want to use the chat, but we also want to take advantage of the question and answer. And sometimes people have only maybe used the chat. So if a couple people could jump in there, I think I saw Mike Carr's in the audience. So Mike, you can be our guinea pig of the first person to ask a question. We want to make sure that these tools are all functioning so that you guys can ask questions on the fly as Deb's going.
Mike, is Debbie a good golfer?
Who is he? Can people see?
Who's your favorite child? That's cruel. Well, they're all special in their own way.
I'm the only one in the room right now, so you can answer this whenever you like. They're not going to be watching it later.
Well, I do have to say, only because he's the guy that takes all the heat from the 3 sisters, I do actually have to put a plug in for Colton, because he truly takes heat from all the women in the household. So Colton and Cliff just go along with things. That just relies on us being louder and them not wanting to get stressed anymore.
If anyone else has any burning questions, please use the chat or the question and answer, just like Mike has done. It just allows us to queue them up and get to them quicker. Sometimes it can get lost in the chat. I don't know what you guys see, but when we answer it live, I assume that it shows it in that chat option there. So I'm just we got Mike's question, and if anyone else wants to jump in, please feel free to. And since the polling's officially closed, I'm going to share the results of that so you can see that quickly. And we'll be relaunching it at some point for the mental well-being talk, but I'll share that for a brief moment.
Perfect.
So you can see the breakdown. So you said that more on the 60-40 in a sense that are either kind of concerned or very concerned.
Yeah.
And then only a couple people are saying, everything's okay right now.
Yeah, which is kind of what I expected, but and it's going to probably change every day that we go out and test this right in public, so and on the news. So let's go into the snapshots of 2019. So 2019, take it back. It's been a while, but not really. So what were the things that we were talking about as it relates to, and this is kind of like a bigger picture of benefits. It's not necessarily benefit design. It's really as us as an industry. What were the things that we were going to be thinking were going to be important as we moved forward? So one of the things which you'll see, this is a common theme, virtual healthcare. They were already getting into that conversation. They were trying to move into that space. But the reality is the insurance world wasn't really doing too much of that. There was independent providers that were saying, this is a good place to be. The push and shove of that is that we as a community weren't quite ready for it because we all were kind of in the one mindset, how can you get answers from a doctor on a telephone call? right? I need to go see them. And so I think it really stalled what the benefits of virtual healthcare were going to be. And we'll talk a bit more about that as we go through. But what was interesting is back when they did this, there was an HR trend study done by Morneau Chappell, which is a large consulting firm. And at that time, 6% of Canadian businesses were offering this service. And I'll suspect that those were the larger organizations that were doing this. As compared in the US, where they had it double in 1 year with a 75% engagement, again, with larger companies. So our world over here, your world, is probably that mid to small market, but we also know that anything that happens up here eventually makes its way down. So one in particular, employee assistance programs, none of us in the private sector world, or very few of us ever used them, but you knew that the big companies were doing it, right? The PCSs and the universities and things like that. So it starts here, it makes its way down. And we talked a lot about that in our Facebook Live. We had one of our providers, Wello, address this. And it was interesting when we were doing the research on it. This conversation was happening 30 years ago with the governments, and yet we just couldn't get anywhere with it. Maybe it was just lack of knowledge of how to manage the technology, lack of belief in whether or not it made sense. And you know what? Sadly, but this is what it's become, is that back then maybe they didn't have a true business case. And we do have a true business case, and we'll talk about that a bit more. National Pharmacare. So that's been the big talk out in the industry. Streamlining our, Canada's the only country, interestingly enough, that we all have some level of pharmacare, but when it came to the drugs, Canada is all over the map. Every province has their own drug plan. So they basically said, we should pull this all together. We should get some, volume deals going, and let's streamline this. And so everybody's the same, regardless of whether you're in Alberta or Saskatchewan. And it sounds great in theory, but the push and pull will be some of our provinces had very robust drug plans compared to other provinces. So Saskatchewan, for example, we have one of the least robust drug plans, and along with one other province. So we'd probably be happy if Pharmacare came along, because then we could get some extra drugs under our drug plan, and the government would pay for that, right? Right now, the group benefits are paying for that. And interestingly enough, some of the consultants in our industry were a little bit fearful of this, because they thought, well, if Pharmacare comes along and we lose the potential to have a drug plan, we lose a piece of our business, basically, because we're paid based on our premiums. And I would tend to say, yes, yeah, maybe that would be the case. Maybe we can offload to the government. That would be okay. But then what it does, in my thoughts, is that it opens the doors up for the ability to have now more revenue to apply to other things. And those other things will be coming forward as we go through the post-COVID. So streamline, not sure. Predictive analytics. So looking at data, we've never really done it. We kind of like, we go forward, we make mistakes in the industry, as many businesses do, and then you learn from your mistakes is what you do. And so then one of the things we thought about is, like how much better could we be if we really start to analyze the data? So that's where the technology is really taking a foothold, and you're seeing a lot more of the large insurers start to really dig deep and provide that data and provide it to clients so that we can, provide consulting that's based on real things that were going on. So that's important to identify those trends. Run and Cool, I really hope this stays, is that they were really moving towards pharmacists. De-prescribing, they were part to a study to de-prescribe. So for example, if someone was diabetic, and you know that through diet and exercise, you can modify it, minimize it, and maybe reduce and eliminate your medications. So they really moved towards a more holistic approach of trying to coach those individuals into healthy eating habits, going to the keto diet, for example, and saying, what could we do to help them be healthier so that we can move them away from the drugs, which I'm sure that anybody that is on medication on an ongoing basis would probably love the fact that they don't have to. So that was interesting that was even a discussion item. And then lastly, consolidation, and this is kind of, again, the industry thing. What's happening in the group insurance world? Well, lots was happening. There was like a big push for big companies to swallow up and buy out small guys. And it was for probably the one biggest reason is that we're starting to see some of the movement with respect to trends and, opening up, the opportunities in different product lines. And you know what? Some companies can't do it. Some consulting firms don't have the back end to do it as well. So you'd see, for lack of better words, if you think about, even just the banking world, how everything started to shrink in size down a little bit and then come out looking a little bit different. That would have been what it was. Was still going on big through 2020. And I'd say it's still happening right now, but the conversations have slowed for sure because everybody's in that unknown what's going on situation. So that was your 2019. So now we're going to kind of go middle of March. I think it was like, the 13th of March when everything just went. And what happened in our world at Wiegers Benefits and Financial, what were we seeing? It was like, whoa, like we couldn't keep up fast enough, and neither could the insurance companies. It was every week I was going on and we were updating information. It shifted, it's changed, it's extended. And there was a couple key things that came out of that. Obviously, the big one that pushed everybody towards these decisions was this rapid layoff. Like everybody was at home now. And some were able to work, but many weren't able to work. So what does that do as it relates to benefits? How do we extend benefits? So we were able to, give a lot of guidance and support to our clients to let them know what those extension of benefits were. We also were really happy to see the insurance companies move forward and extend even further those benefit periods for people that were laid off so that they would keep their disability benefits. They would keep their health and the dental. This was important. This is a stressor if they don't have that protection. So that was all in the course of a few weeks, actually. Virtual care popped up again, right? So it kind of got quiet, popped up, but the problem we had is the providers out in the industry weren't prepared for virtual care. So physiotherapy, they're doing it now, but middle of March, they were scrambling. They're going like, we've got a little bit of something going, but we really don't have a lot of anything. So they're really working hard and trying to get their piece up and running so that we can, with confidence tell clients that your health plan will continue. You will be able to use some of those paramedical benefits, your chiropractor and your massage, not so much massage now, but not back then. Physio, optometry, that kind of stuff. So definitely accelerated it. And I know when I talked to some of the providers, I said, you know what, in a good way, I guess COVID was your best friend because it created this whole massive marketing and you didn't have to pay a dime for it because people were forced to go virtual. And so once they went there, it's interesting to see what's happening once they actually got to try it, feel it, and their thoughts going forward. Premiums. Insurance companies were just so gracious. I mean, they were deferring premiums. They were holding renewals that were going through increases. They were providing opportunities for people to pause their benefits. So lots of creative ways to help the client so that they could maintain benefits through that period of time. Again, they probably thought this was only going to be a few weeks, maybe a month. So it created some challenging conversations, after 6 weeks, 8 weeks went by, and still does to some degree. The out-of-country coverage was the big conversation, and I want to kind of just update on that one. So out-of-country coverage, it was done, right? I mean, if people were to, choose to travel after they were told you won't have any coverage, that was on them. If there was, circumstances beyond their control, there might have been exceptions from the carriers to get them back home. But certainly walking into a known, you wouldn't have had the coverage. Today, they brought that back. For the most part, travel benefits are available through group carriers. There is some carriers, insurance companies, that are putting travel the restrictions based on the travel advisory. So if they're level 4 travel advisory, some insurance companies will not provide the insurance coverage. There is too, and I'll do a shout out because I think it's really great because there is situations where people do need to travel still. But I would be looking at Blue Cross and Chamber of Commerce right now. For what I know, they don't have any travel restrictions. And remember, this group is very different than individual. Individual does have restrictions, and the group, some do and some don't. So you have to be very careful and read the contract. If you have any questions, pick up the phone and call us. We deal with all the insurance carriers out there, so we've got a really good read on what's happening. And it can change, and we'll be the first to know that as well. So, so trip cancellation might play into some of the contracts to provide some additional benefits. But if you're put into isolation, it's not a benefit. It's not an emergency out of country benefit. Okay. Lastly, mental well-being. So now more than ever, lots and lots of conversation and discussions on supports. So the biggest one we saw through the COVID period is that every time we had this conversation, we would tell our clients, you need to really educate people on your EAP, your Employee Assistance Program. That was kind of like the big anchor of that mental support in the group plans. You had psychologists, some had social workers, but what we're going to see is that was the thing that will be starting to still continue to grow. They did a wellness survey. So the Sanofi, and maybe I'll get Colton to put this on there, but one of the great survey reports is the Sanofi Canada Health Survey. And I tell you what, there's a lot of great information, but they did a lot of polling, and one of the polls was 86% of the plan members agree that a workplace environment that encourages health and wellness is important on the job search. So it was important in COVID, and you'll see there's a common conversation that carries on through this. So it's the one on the clip, Colton, and at the end, I think.
Okay.
Yeah, there we are.
Perfect.
All right.
I'll get a link to that, and I'll post it in the chat in just a moment.
Yeah, it's got some awesome information in it. So mental well-being, absolutely. It was like, because that's when the stress levels were starting to build up and the anxiety and you know, all this uncertainty was happening. So predictions now. So if we were going to look at predictions, seeing what was happening in that COVID period, what would they look like? It's interesting because I think there's going to be some common themes that everybody's going to grab very easily, but there's going to be some ones that are kind of just like, actually surprised me a little bit until I started to kind of walk through it. And I thought, yeah, that does make sense actually. So this is where we had injected the
Last question on mental well-being.
Do we have to put that poll out? Can we, or is it done the poll?
No, we can put it out again.
Okay.
We're going to relaunch, and I want to just get everyone's opinion one more time so we can show it again. For question number 2. So you can skip ahead of question number 1. Unless Deb's talk has made you less concerned or more concerned, you can feel free to answer that if you feel better or worse after the last 20 minutes. But we're going to relaunch the poll. We want to hear your feedback on the mental well-being side.
Yeah. And think about this, and I'm always, curious to get your feedback, but as we go through this, you already can kind of go back and say, look at your benefit programs. If you're the employer that, has the benefit program, or if you're the employee listening in, you still can ask yourself the same question. But what is it going to look like? What is going to be the benefit that is going to provide the greatest value? Like, what will that be? We can say 5 years ago, 10 years ago, maybe even 3 years ago, it was all about vision care, right? Everybody wanted vision care. Everybody wanted a better dental plan. But ask yourself today, if you were rolling out a benefit program or modifying, what would be the benefit that you believe is going to provide the greatest value to your employees and turn benefit you as an employer, because they'll have a total respect for you. So again, feedback, not a poll. So predictions going post-COVID. So we're going to have predictions, and then we're going to kind of move forward into post, meaning this kind of stuff's actually starting to happen. So predictions, they believe that there'll be an increase in dental dependent health and dental claims. And they went, well, that's kind of odd, but think about it. With a lot of people not having benefits, they're going to be going on to the spouse plan. And so that in turn will increase, if it's your plan that they're bumping into, then that's going to increase their exposure risk in terms of just the increase in claims in there. So because the permanent layoffs are now starting to happen, I do believe that we're going to see this now coming on board on a dependent basis. So maybe that's a good time to go through and do an audit of your benefit program and re-ask the question to your employees. They need to be sure about what coverage they should have, whether they're a single, whether they're a family, because we don't want dependents to be lost in the gap of that. Spike in health and dental claims. Well, I guess if you would have asked that question in the midst of COVID, we all would have said, well, how can that happen? Because drugs were still okay. Drugs are moving, but we had a drug shortage. We had a drug shortage that, started to concern the pharmaceutical world. And so they started to pull back and look at 90-day prescriptions being prescribed 30 days. So that was there for a few weeks, probably a month, until they felt comfortable that the supply chain was still intact. So there was kind of a shortage, or maybe this fear of a shortage, which made people want to go out and buy more, kind of like the toilet paper. It's softened. It's softened a lot because we've gotten better at managing that. But would there be a spike in the health and dental? Well, when the dentists came back out, when they were able to come back into the workplace, there was usage, but what our clients were seeing is, yes, there was emergency visits. You could do that, but there was restrictions on the emergency services. So it really couldn't help a great majority of people, even on an emergency level. I know we had one colleague and he said his father went there, but they told him they can't do the procedure for a while yet. So it didn't help him much. So there was a slowdown. We thought when the dental offices started opening up, it would be this let's just catch up. It's not happening because they still have their restrictions and it's still playing into the business model for them. They're trying to work it out. And what's happening is people are starting to maybe realize that the mentality is changing a bit, because a lot of times we would hear from our HR teams or from our clients of going, well, here's the logic is if they have it, they're going to use it. And that's what the employees tell me. If I got it, I might as well use it. If I got my massage, I might as well use it. And that's what they did. Now, whether they needed it or not, it's not for me to decide, but the mentality was a use it or lose it model. If they have been without it and they've had to manage through this and figure things out, they might be realizing that maybe I didn't need to go to the dentist, maybe I could be doing more personal hygiene. Maybe I can be doing more to take care of myself. Maybe I can do more stretching so my back's not going out. And it's because the ability to go, it's tough. It's a lot tougher than it used to be. And it's just making people think twice about whether or not they need it. So unfortunately, that's what we're seeing is a little bit of that. Is that going to change in the next few months? It very well could be. It could be, because right now we're still in the crux of, the business is not quite being 100% back into work, right? Of course, we said virtual care, absolutely. Why? And I'd said before, I said, why would we want virtual care? Well, you know what? The business case was always there, but COVID accelerated it. And I know personally speaking, as an employer and as an individual, I am 100% happy that virtual healthcare is in our space, because it allowed me to call my doctor and have a telephone appointment and not have to go down and be stressed about sitting in a doctor's office. It allowed me to have the same level of conversation. Yes, sometimes you have to see them in person, but there is a business case on the financial side. It allows as an employer, it allows my employees to get best care, but minimize the time, because a lot of times there was having to leave early and being at the doctor's office for longer than they anticipated. So on a business level, absolutely, it made business sense to us. And the one thing that they were noting is one of our biggest problems with drugs and the increase in the claiming patterns is, and the disabilities, the correlation is people, the adherence to their drug program. So we're probably all guilty. What would happen is that you'd run out of your medication and you got busy and you haven't had a chance to see the doctor, but maybe you can't see him for a month. You may be feeling better and you may be stopped. And that's a huge problem in the insurance world, because what would happen is that people would have relapses, and then there would be, a wastage going on, and then it didn't win. No one won out of that. So having a virtual telephone call, you know what, I've got 1 week, I'm at the end of my prescription, here's where I'm at, here's how I'm feeling, doctor, what do you think? it can really move that conversation forward much more quickly, with much more ease as well. And mental health, lastly, mental health care, it takes center stage. It is the one and only conversation that seems to come up. They actually termed it chronophobia. That's what we've become. We've got chronophobia, Colton. And it's true when you think about it. Right now with school starting, there's a lot of people stressed right now because everything that they were doing in their world over the course of summer, they were probably getting adjusted and feeling really comfortable with, and now they have to move back out to that public space, and it stresses them. So, and especially if they got family members that are compromised, health compromised, it definitely is a stress. So chronophobia. So what are we going to do about it? Well, we're going to have to be rethinking how we're going to really just change the model of what we do offer in the mental wealth space, mental well-being space rather, because we do believe it's chronophobia or coronavirus is going to increase disability claims, and most of it will be as it relates to stress. And stress takes on many forms, and stress and depression. But what's interesting is, and I'm sure there's some in the audience, I know I can raise my hand, is it's going to be anxiety. It's going to be the anxiety that's actually surpassing depression. And that's the space that we now have to get better at. And they actually are saying that it's the children, it's the young adults, it's the young adults from 18 to 34. If we had more studies on the children, I really believe that that's what we're going to see, because they're feeling and seeing everything that we're doing as the parents and the adults. And so you can't dismiss the fact that they're starting to get anxious at a much lower level. But it's the 18 to 34, and it goes back to many times we talked about it, and my favorite book, Bill Howitt, The Coping Crisis, and really starting to work on those things that are providing resilience to get people feeling better and making decisions and calming themselves. And it's going to take on many different forms, but that would be probably one of the focus parts when it comes to mental well-being, for sure. Go ahead.
I was going to say I can share the results of the survey.
Oh, yes.
So we had a couple people that I think probably just answered the one time and figured they were good. So I think we only had 7 responses in this one. Not anything conclusive in terms of if you have stressed or de-stressed anyone in the first half of your presentation. So that's good. That's relatively the same. And this is relatively the same too, with maybe, 1 vote more on this side and 1 vote more on this side, but it was roughly a 60-something to 40 or less split. So most people thinking that mental health and mental well-being will be the most important benefit or most important area to focus on going forward.
Yeah. You know what? And it's kind of it's the beast that's going to be really tough to navigate because of so many different areas. And if we got some time, I'll focus on that, because every industry's got different ways and abilities in which we can even incorporate in that space. But when we talk about it, the mental health care, what we do need to be concerned about is how it's going to impact the costs. And we are going to see, sadly, we're going to see some increases in benefits. We're also going to see some decreases. And again, this is part to what we're seeing, a little bit maybe to my prediction as we move into this last quarter of the year. So what's going to happen is health and dental, I don't think it's going to replace what we lost. It's going to increase, but I don't think it's going to be making up for what we lost over COVID, just by virtue of just now people having to adopt different practices. And succumbing to the fact that, you know what, maybe they don't need to go put themselves in the public, right? They're not very comfortable with it yet. The disability side, we will see increases, absolutely. And it's going to be 2 things. Definitely COVID's going to drive it with anxiety and stress. We're going to see a spike, I believe, in the next months to come on that side. So it will increase, the activity, the claims. But the other thing, kind of the business formula to that, is you need to understand that if someone does go on disability, what the insurance company needs to do is, if they anticipate paying 8 weeks of a claim, for example, they have to be projecting forward and saying, what's the cash that we need to have in the kitty to offset this claim? And when you get into longer term disabilities, now you're moving into reserves. They need to put money aside on the off chance that if this individual is going to be off work for 3 years or 5 years, they need to be able to pay that benefit, and there's going to be interest rates attached to that. Well, interest rates are virtually zero. And so that's hugely impacted their financial bottom line. So yes, you're going to see increases, whether it's got anything to do with you, it's the pool itself, and every insurance company is going to go through that. So don't kid yourself that one is going to be able to save the day. They're not. They're all in the same pool. So not pool, but they're all in the same space, and they're going to have to make adjustments come the new year. And we're hearing upwards of 10% is what it's going to be. Just call it a manual rate adjustment is what it will be. So that we'll be looking at. So maybe the disability increase offset by the health and dental, a little bit of decrease might still make out. But at the end of the day, if they're going up, it is what our world has become. And to be without a benefit package, I don't think that would be an option in today's space. Employees really rely on you to take, that step forward and provide that peace of mind and that protection for them in a way that is meaningful for them. And of course, we said, the increase in mental claims, we'd address that as well. Now, that's one thing that we had started working on, actually, interestingly enough, pre-COVID. We were working on benchmarking. We do have many, many clients, like hundreds of clients. So we have a pretty good read on what's happening out there with regards to, the bigger picture, specific industries, not-for-profits, the trucking businesses. And we can get a pretty good sense of where the competitiveness of the benefit plan should be. Now, it's going to shift a bit, so we'll watch and see what happens in the next 6 months. Are people going to look at dropping benefits? No, they're not. They're just looking for solutions to be able to move through these, these moments in the next weeks and months. So if you're curious, that's what we are. We've got actually surveys. We've done crafted 2 or 3 versions of a survey. So it's depending on whether you want to kind of get a little bit more of a robust survey out to your employees and get that big picture feedback, which would include that in the space of what, mental well-being and the personal and professional development, those types of things. And it can be just focused on the benefit plan design as well. So there's our predictions.
I'm going to post right now too. I just have to pull it up. So I'm putting in the comments here a link to that survey that Deb had mentioned, the Sanofi one earlier. And if you open that link, there's an option to download the survey as well as download, I think they have kind of a webinar or a walkthrough of those results. We had been comparing the 2020, you were looking at the 2020 versus the 2019 results.
Yes.
And I don't know, were you going to mention any differences, or people can obviously take a look at them both as they please?
Maybe on another, because it's like a 50-page report. It's pretty big. But honestly, the ones that we were talking about today, that's why I wanted to print 2019 to see what was changing a bit on the 2020. It'll be more interesting to see what happens on the 2021 survey, actually. Mm-hmm. So a lot of common themes, just some are moving a little bit quicker than others is what we're seeing. So post-COVID, we got to get busy and wrap this up. So what's actually happening? Predictions. Now, what's happening? And again, it's almost a little bit too soon to see in some of the areas, but I can give you a good flavor. There was a survey done by Arthur Gallagher and Company, another large consulting firm, and they surveyed their clients. And to my point, I just mentioned a little bit back, 72% they are saying will have no change or very little change to the benefit program. So that's, in my mind, good to know, because, again, we hate to think, sometimes it's not possible to keep them, but we hate to think that people will lose their benefits. There will definitely be an expansion on the whole well-being model in terms of the offerings and the benefits that you might attach to your health plan. But it's not just going to be in the mental space. Well-being in our world is very much more holistic. So when you're looking at it, you're going to be looking at mental, yes. Physical, absolutely. And financial. The surveys will tell you that financial stressors have hit the top in terms of what's stressing people most. And that's 39%. And then there's, still the physical or the mental comes in and a high state. But that's how quickly things have changed. Where, think about this, when people don't have their jobs or that half their revenues are coming in on their businesses, that keeps them up at night. So what is it going to be that they need to do to go forward? There's absolutely going to be an emphasis on virtual access. The insurance companies are getting better as the days go by to, provide, the types of services that will complement, the benefit program and play into what people are wanting, and that's that virtual care. The providers out there are, doing a great job, and there's still more to come, absolutely. The fact that there is a little bit of virtual movement with massage, I'm not quite sure how, but I'm glad that they worked it out. And I think that's important. Maybe that's just a training online where it's teaching you how to do different types of exercises. Whatever the case may be, it still works. What we're going to see probably is when we talk about change in plan designs, I believe that if not moving into the employee assistance program side of things, you're going to see more of that. And you're also going to see these providers being better at what they're offering in that space. So do not look at best dollar wins on an employee assistance program, because it's similar in my world, wouldn't get into critical illness. You don't offer critical illness for half the price and only cover half the illnesses. You can't do that. But you could, but it'd be very dangerous. You want a robust employee assistance program that really does have those tools and resources that will help your employees. That'd be important. And we work with, a few suppliers that have really bumped up their EAP portfolios and other providers. So again, have a very good flavor of what's going on. There's going to be maybe, I think, a bump in your paramedical. So your massage, chiropractor, psychologist. You're going to see people that might rethink and maybe go with a higher psychologist benefit versus a massage or a chiropractor, and adding in maybe social worker. So trying to provide more levels of coverage under their paramedical plan, because they want to really start to move into helping in that mental well-being space as well. Interesting, another survey, Mercer Marsh did a survey, and when they talked about, and this is, I think it's moved much quicker, so maybe this was a few months back, but they did a survey and they said, how do you feel about virtual healthcare? Not just virtual telemedicine, but virtual healthcare in general. But the other people indicated that 39% said, sign me up, I'm in. The other ones are saying, you know what, thinking about it, get me comfortable. Just get me comfortable, and I think you could move me there. 15% are waiting to be impressed, and only 6% said, forget it, never going to happen. And that 6% is going to be in your latter age groups. So your 55 plus age groups. I just had a conversation with someone yesterday, just brought it up in a conversation. They said, that will never happen. There's nothing my doctor can, I need to see him in person. I can't have this conversation on the phone. So it's just, where you are, I think maybe on the pendulum of age as well. The millennial generation is definitely moving this thing much quicker. Let me see. And a lot of it will be doctor appointments, but fill in prescriptions I'd mentioned. So again, a survey by Green Shields, which is a big drug provider. They said 67% of the people surveyed will have no problems getting a prescription refill. That would make sense. I did it. It's awesome. They're also going to move towards our next point, pro-health environment. We're going to really start to see a lot of people really rethink what's the environment at work, at home going to look like. And pro-health is going to be top of mind. At work, it's definitely going to be about safe work environment. There's people reviewing their occupational health and safety policies and really thinking about what do I need to do to relieve the stress of the people that we need back at work and that would want to come back to work. I mean, there's still people that want to come back to work. If we can minimize the risks for them, then we're in the good books. And I know Pat talked a lot about that at the session in July. And have very clear HR policies. You have to be very clear about what you're doing, what's expected of your people, because you don't want these to be problem areas down the road where people didn't understand what was going on. So I know Pat's really tightened up on our HR policies as well. Digital, absolutely. I mean, everything's going to be digital. The insurance companies are coming in, and now that we had to go through COVID, everybody is able to actually put an entire group online in place within weeks. So before everything was driven, well, not everything, but a lot of it was driven by paper. So now it's going to be online enrollment, the ability to sign for beneficiaries or sign beneficiary off. And it's going to make life so much easier, especially when you're dealing with clients in remote areas or employees that are in remote areas. So definitely digital is taken over. And flexible. We're going to be looking at flexible. So already our space is including spending accounts and wellness accounts. And there is always been a little bit of activity for that. But what we're going to see is that place is going to grow. I'm not looking to expect, and I wouldn't ever want to suggest that people would drop a health and dental plan and then put in a spending account, because there's a lot of big differences that you need to understand about that. So it's usually about complementing, looking at what you have as core benefit program and complementing it with a health spending account, which provides that flexibility and accountability to the employees, because now they have the cash and they control where to spend it, and they need to make wise decisions. It's going to be important because once they spend it, the cash is gone. It's not like a group plan where it sometimes ends up being a little bit more endless. This is a decision that they have to think about. So there's nothing wrong with that. A survey done, again, was about who's going to be looking at these. We well know that the larger companies have more capability and will be implementing it, but companies less than 250, there's about 20% now that are moving into this flexible space. So we'll be seeing, I think, that ramp up a little bit more as we move into the first quarter of next year. And strong communications, like you absolutely have to communicate benefit programs, what they can do for you, how important it is to communicate to your family members. You need to know that, or they need to know that there is things in place that are there to help them and their families through these unprecedented times. And the anxiety and the depression and the mental well-being space, this isn't going to end just because we got the vaccination. The vaccination, from what we're hearing, is going to probably, they hope, in January. Some maybe are hopeful maybe earlier. But you need to also understand there's going to be a protocol in terms of who's going to be able to get the vaccinations first. So it still might be a while before we see that this has totally solved our problem, if it's solved our problem 100%. I've got a couple quick, real random things. So that's the post. I don't know if that's, you know, talk to me, but did that surprise you to see what we're seeing and what you're maybe thinking and feeling? Your feedback, I mean, you know, your questions are always helpful. I'm not surprised by this at all. Actually, and I look at this as an opportunity. I think this is a positive. I think there's a lot of great things that will come out of this. No, I didn't want COVID to come along, but I think it's making everybody rethink what really now is important, and what you need to be thinking about in terms of just creating that environment so that attraction and retention is going to be, I mean, certainly working in your favor as well. So I'm going to pause for a second. I do have a couple quick comments, but I don't want to, if there is any questions. We got a quiet bunch today.
Yeah, we can kind of let people type and such. I'm curious too, if some people could jump into the chat to say this. I don't have a poll set up. Who's working somewhere or currently is working remotely still, and who is totally back to normal office full or retail? Sometimes, you know, you have to go back. You can't really work remote in like a retail setting, for example, because to me, that's the big change. That'll be more of the long-term one, is that people got a taste of the remote working life, and some people have always lived that life depending on what field you're in. And I think it's hard to scale that one back. If someone can show you that, hey, I've been doing my job for 6 months, and do you really have a problem with it? Because you told me I've done good. Why are you making me come back? For, you know, health reasons, but convenience, family, things like that. So I see we've got a couple people. So we got someone back to 2 days a week. That's Josie from West. At home's 3 days, slow and gradual. Paula Collins says that working remote still. Danielle Holtorf says working remote still as well. Anna Shuchuk, working fully at home. I'm saying the names in case you recognize
loving it, too. And loving it.
Loving it. There you go.
Some don't, but some do.
Yeah.
Yeah.
That's I think one of the hardest things to overturn going forward. Is if someone can do it at home still. So I guess we got most people either fully remote or partially remote still. We're a bit of a mix at our office still. We have some, we're trying to encourage some, you know, face-to-face with the teams, but still respecting that some people aren't fully comfortable and feeling safe yet coming back. So it's it's a marathon on that one.
Well, and it's because there's so many varying levels of how people are handling it. So it actually gets kind of confusing. I'm not gonna lie, because some places like, oh, don't worry about the mask. And then other ones it's like, oh, put the mask on, put the mask on. And I know our office, Pat alluded to this, is that we are mandating masks in common spaces. If you're in your own office, you reserve the right to take your mask off. Our front door is still locked. Our clients have to knock on the door and be led into the client room. So we do have some fairly stringent protocol levels, and it's just adapting to that. But it is what it is. So any other comments there?
Paula just followed up and said, working remote till mid-October, then 2 times a week for a few hours. So again, everyone's kind of, there's a balance and no one's jumping right back in yet. I know when we talked to Mike a bunch, and isn't Blue Cross pretty well still fully remote too?
I think, Mike, as you said, the middle, maybe the end of September. I think there's a slow movement in, but all of Blue Cross has been up to this point, like at home. That's over 200 people. That's a lot of technology to suit up in a very short time. I know what it was like for us with 40. Our IT guy was working around the clock to get things done. So yeah, it's going to be all over the map. And really, if there's a resurgence, it could just all of a sudden pivot and do a 180 again. We just don't know, right? I wanted just a couple quick moments because we're running out of time. I do want to just say thank you again to WESC for the opportunity to allow us to essentially do 2 sessions with you. And as I had spoken, and it took me a while to kind of wrap my head around it, but Debbie had to take a little mental well-being break over the summer. And so the good news is it was the summertime. I worked pretty hard, maybe too hard. I worried a lot. I worried too much. And then eventually, you know what? The old ticker says it's time to slow down. So it was like, okay, you know what? And I really actually say, kudos to Colton, because he's the one. Sometimes when you're in that space, you don't see it. And Colton, I have to say thank you, because he was the guy that said, we need you around for a long time. I think, you know what? You need to just take a step back and relax and enjoy the summer. And of course, I can't do that. And then I had to, because the old blood pressure said I can't. So I was really happy that I could do it. I rethought what's important to me. We've moved some, things around in the company, doing some of the things that we've been wanting to move towards anyway. Actually, we ramped up our social media. So shout out to Sarah from Trusted Saskatoon. She's done some awesome work for us and helped. So it's moved me out of that role that I had a portion of my commitment to. And also to Hanif from Express Employment. Hats off to you, managing the team. I said, I had to move away from some things just to gain some sanity back and let the people want to like me again. So you know what? It was the best thing I could have ever done. And I had reservations about talking about it. But when we go through this isn't just a conversation because this is my business. This stuff that we talk about is very real. And I'm that person that had to, experience it from a health perspective. And I'm still a pretty young gal. I want to be around for a very long time. And I really encourage you that if you feel that you're going into that space, have a conversation with somebody, your best friend, your mother, your employer, and have that conversation and be straight up. And have the intent to want to get better, because you just can't sit. It just doesn't go away. So I will probably share with you some great books, and I know I have to close it off, but I will start off with this book because this was my lifesaver. Don't Feed the Monkey Mind. And I tell you what, it was that got me into that, all right, I got to get a grip and start working on it. But it's how to stop the cycle of anxiety, fear, and worry. And it's by Jennifer Shannon. And it's the easiest read you could ever imagine. And I encourage you, I've got many books, Living the 90% by Darcy Lang. I don't know if you can see that one, it's quite bright. But a lot of you have seen Darcy Lang, I know that. And another great book was Louise Hay, You Can Heal Your Life. So that book, I always go by colors, so I'm a visual. So if you see that, this was an unbelievable book. It really was. So I encourage you to read. I encourage you to really spend some time thinking about what's important in life. And with that, I'm just thinking we're
We're at one.
Right at 1
I
o'clock.
saw a couple quick comments. So
Okay.
Hannah just said, thanks for sharing your experience, Deb. Conversations are so important. And I agree. You know, it's you and I have chatted, and obviously we have a bit different of a, you know, it's not just coworker relationship, of course. And being able to come out and say, hey, I needed to take a break, I think is important. It's important for everyone, right? We, like you mentioned, like you don't realize your own limitations because you're kind of just stuck in that zone. You need someone else to look on the outside and say, hey, like I'm seeing some, you know, trends, and you don't want to keep going down that path, whatever the path might be. So, but it's important to talk about. I'm sure we've all seen people, you know, varying degrees, family members, coworkers, friends, you know, everyone's handling COVID different, and it's just piled a lot of stress onto what can already be stressful times depending on where you're at. So an important message to share for sure.
Well, it's almost like once you actually deal with it, you grow and you heal that much faster. I know that sounds like, but it's true. And I know my limitations, and trust me, I push them still, but I also know when I need to back off. I want to say a huge shout out to my team because I kind of just disappeared on the nicest day at the end of June. I just said, I'm out. And they were fabulous. They came in, they picked up the pieces. It really allowed them an opportunity to grow and thrive. You know, Debbie can leave and things do happen. And you have to trust that with your own team, that they're there for you. And that's what you'd always want to work towards. And so to Pat, to Colton, to Brenda, who's leading the benefits team, I want to say, like, thank you. So on that note, I'm going to say a last plug to my great friend Joy from Etceteras, because I have to just sport my new, see? If you see what it is, it's a bumblebee. So it's really actually indicative of Debbie because they always call me the busy bee. So there we go. They're awesome. She's got some really classy ones, and they're breathable. And they're stylish. So now that we have to wear them, let's look good in a mask. On that note, thank you everyone for joining in. It's been a pleasure. Thank you, Wesk, again for allowing me to speak. And I think on that note,
we'll turn it back over to Wesk in a moment here. And recognizing it's 1, if you have to jump off, I'm just going to send a email I'm throwing Brenda's in there because I figured this is probably a good central point. If you'd like any links for surveys, or for future seminars, things that we are doing at Wiegers, you can email Brenda. She'll send you in the right direction depending on what you might be looking for. If you wrote down anything that Deb mentioned, you said, hey, could I get access to that information on that survey? Please email Brenda there. So copy that before you might have to sign off. I'll just give 2 last quick shout outs here.
And thanks, Michael. I just read your comment.
Okay,
Thank you for that. Yeah.
Mike's always a big supporter. And
glad you learned.
And wanted to mention quickly, we have a couple members of our team, Matt and Renee, both in the group benefits area on the employee benefits, and then the group retirement are doing a session on September 15th. I said back to school basics of group benefits and group retirement plan designs, how to give choices to your employees and spend less. So that one will be advertising through our Facebook and LinkedIn and such. But again, if you'd like to just keep in the loop of that one and register and join if you're free, please email Brenda from the email that I put in that link there.
Yes.
Yeah.
And they'll have some really great content to share. And you know what, sometimes when we say get back to basics, it sounds simplistic, but I'll tell you what, sometimes the basics are the most important place to start. So look forward to hearing them present next week.
It'll be really good. And then we'll give it back to Josie and she'll close us off. Thank you again,
Thanks, Josie.
All right, awesome. Well, thanks, Deb, for chatting with us today. I know we greatly appreciated hearing your story and learning some more through what we can do through all these COVID times. So thank you. And thanks to all of you who joined us today. I hope you learned something valuable and can walk away with something to help you forward through COVID. As a reminder too, you'll be receiving an email from us tomorrow with the link to the on-demand recording. And you'll also be able to find this directly on our small business resources page. So on our website, under resources, you'll see a tab there that says small business resources, and that's where those all are. So our next webinar is next Wednesday, and it's on understanding the internal controls of your business. And if you haven't already registered for that, you can do so at wesk.ca/events. And with that, I will let everybody go. So bye, and have a great afternoon to all of you.